we are looking at the implications of having tight hip flexors in your posture and exercise. So if I drop a plumb line from the back of Karen's head, what I'm looking for is in a neutral posture, I should be able to get 1.5 fingers behind her back. If for some reason her hip flexors are very tight, what will happen is, as Karen just showed there, if you take that arm forwards, there's a much greater gap there. So, it's trying to get patients to understand how to pelvic tilt. So, I'll put my fingers there, and I'm going to get Karen to shut that gap again. So, pelvic tilt's good, but without losing the vertical nature. Because often people come forward with their heads as well, like that. Okay, if we're just going to look at one leg to start with, so if you can take your left leg forwards. Now, in an ideal world, in a runner, in a sportsman or woman, if I do a plumb line from her ear, I'm guessing this, I'm wanting the plumb line to drop in front of the knee, and at the moment you see it's not. So if I now do a plumb line here, and I get Karen to do a pelvic tilt, so, and she mustn't sink down, she's got to keep that vertical nature, and then take everything else just slightly forward, but she's got to maintain that space with only one and a half fingers, maintain here. And now what's happening, if I do a plumb line from her ear, I'll do it from this side, the plumb line is now about that far. And what's happening, if you turn that arm forward, is she's getting a stretch on the front of this thigh, and that's a deep hip flexor stretch. But one way of making sure you get a better stretch is by contracting the opposing muscles. So Karen's contracting her buttock, which will allow you to release the front here. By contracting the tummy, you get release here. So what I look for is diagonal. So this diagonal here, if the hip flexor is tight and the back is tight, relax everything, you'll tend to do that. So it shuts down that space. But if we can do a pelvic tilt properly, then you're gapping that space. And so a tight hip flexor can often limit the ability for you to be able to bend forward at your lumbar spine. It's a really, really important and often misstretched and misunderstood muscle in the roll in back care.